Hello, everybody. All right, we're going to wrap up Mental Health Awareness Month with the third myth of mental health treatment or mental illness treatment, mental health. And that is the myth of the chemical imbalance or the myth of the silver bullet. This idea that a medication is going to correct your imbalance and then you're not going to have any mental health issues. The first part about that is these disorders, depression, anxiety, ADHD, are not caused by chemical imbalances. There was never any basis for that claim other than to get you to take medications. Now, that does not mean that medications don't have an effect. They absolutely do have an effect. It's just not what you think it is. So, anxiety, depression, ADHD, bipolar, these things are not caused by a chemical imbalance, and we know that. However, there are some medications that might be helpful for those things. Think of it this way. If I happen to be, which I am, socially awkward in big settings, not awkward, socially uncomfortable in big settings, it might be helpful for me to have a drink or two when I'm at a party just so I can relax and have fun. Now, no one would deny that alcohol is having an effect, and it's having a positive effect in the sense that that's helping me relax and have fun. No one would make the argument that I'm correcting that the reason I couldn't relax and have fun before that was because I had some kind of alcohol deficiency. And no one would make the argument that I'm correcting an alcohol imbalance by drinking or having a few drinks so I can enjoy the party. So medications can work. They will have an effect on people. Sometimes that effect is different based on the person. So sometimes it takes some trial and error to find the medication that might help. Now, medication is not more effective than therapy. In fact, in studies over the last 50 years, it has become very apparent that medications work and therapy works, and they work to about the same extent. They have an effect size of about 0.31 to 0.33, depending on the study. So each one works. It just depends on which one you want to try. Also, the combination of medication and therapy does not appear to be more effective than one or the other. So each one works, medication and or therapy. Combining the two also works, but does not seem to have additive effects. So when you combine the two, you get an effect size of, say, 0.35, 0.36, slightly better, but not statistically or real world better. So few things just to wrap up here. Mental illness is not caused by an underlying chemical imbalance. That just simply is not true. That is something that the marketing agencies for pharmaceuticals want you to believe so you could go out and buy the medications. However, medications might be helpful. Here's the caveat in the short term. So we do know that long-term use of medications, say anti-anxiety medications over years, will actually increase anxiety, or long-term use of antidepressants over years will actually increase depressive symptoms. So you want to just be mindful about that. But in the short term, like a year, 18 months can be helpful. Therapy is as efficacious as medication. One is not better than the other. Medication is not better than just therapy. And the combination of the two does not appear to be more effective than either one in isolation. So it's all about trial and error, finding the thing that works for you, and then you being able to do the work with the support of either therapy and or medication. Hope that's helpful. If you have any questions, drop me a comment down below. I hope that you had a great May, and I hope that your summer is kicking off well and that you can enjoy your summer. Much love. Bye.